Rug RMD. This is the simplest way to evaluate a radiology employment opportunity. This is the absolute simplest way. I think if you're getting a per RVU work rate of about $50 or so, 40 to 60, 40 to 50, 40 to 55, 40 to 60, if you're getting about $50 per work RVU, you're in a good spot, and just stay there. I think that's really the shortest, sweetest way to evaluate radiology employment. Do the numbers, crunch the numbers, figure out your per RVU work rate, and if it's about that, between 40 and 60, just stick with it for, 3, 4, 5, 6 years at least, because that's about, I think, where you want to be. Other good things would be that you have benefits. Either those benefits come out of that rate, out of that 50, or if they're on top of that, even better. Make sure you don't have to pay a tail on exiting. That's an expense. Could be 20, 30, 40,000. For me, I paid a tail within the last year of 13,000. That was for working 10 months. So just keep that in mind. 13,000 post-tax income. So about 20,000 earned income. Pretty serious amount of cash. So if you, again, an ideal job I think right now is run the numbers. Are you making about $50 per work RVU? Are there benefits, health insurance, dental insurance, some type of life insurance, some type of disability insurance? If you have those things, you also have a tail paid for, then just stay wherever you are. If you're getting all those things, stay. I think you're in a good spot. And then hopefully you have some productivity component of your income. Read as many cases as you can, as safely as you can. Read as many cases as you can without overextending yourself, and get as much experience as you can. More cases, the more you understand medicine. And it's an opportunity for you as a doctor to never stop learning. You have access to RVUs as a radiologist. Create the value for the patient, create the value internally for yourself, and create the value for your family. One good thing about radiology work is that there's a ton of it out there, and fortunately, it's never going to stop. It just keeps getting used. We have a good service. We have a good technology. CT scanner can get millimeter down to a millimeter cubed information of your body in 3D and have it uploaded in the system in about 2 minutes. We have great information on everything that's going on inside your body, and as a radiologist, you know how to interpret that. Great. That technology is just, because I think it's good, and we know it's good, and it's better than physical exam and other ways to figure out what's going on with a person's body. Because it's a good technology, it gets used a lot. It gets overutilized. Compound that with the fact that there are untrained individuals in charge of medicine at this time. What I mean by that is there are people that are not physicians. Physicians go through training. They go through anywhere from 3 to 6 years of postgraduate training after medical school. So they're trained when they get into the workforce. There are the presence of untrained healthcare practitioners, people that get a degree and then they go work. So they're not trained. That's fine. We need people in healthcare of different backgrounds. We don't just need physicians, but what that creates is when you have an untrained individual trying to take care of a patient, they're going to use more imaging, bottom line. They need more information before they can make a decision. Physician can go off their training. That training instructs them what to do because they've just seen a lot. They experience, 6 years of postgraduate training with a lot of experience. If you don't have that, if you're untrained, then you're probably going to rely more on imaging, ultrasound, CT, MRI, x-rays to help you figure out what's going on. Getting that consultation of another physician, the radiologist. So I see continued growth in imaging, and I see that if you're getting, again, about $50 per work RVU, you're in a good position, stay there. And if you're getting benefits and a tail paid on top of that, again, you're in a good spot, because you shouldn't leave, but even if you did leave, there'd be no penalty. All right. So again, that's my thoughts on it. And again, just a closing thought would be that most private practices, most corporates would offer you something like 25 to 30 per work RVU in the short term. Private practice would offer you that in the short term. Then after a potential buy-in, you could make higher than that, hopefully 50 to 70. And corporate rate, unfortunately, would just be like 30 probably for eternity. So again, just some things to think about. Srel Garam Day.